What's going on, everyone? I'm Attorney Ryan, and I'm answering a really important question. Will you be able to afford healthcare in 2026? Now, that might sound like a stupid question for anyone who's lived in the United States, because we all know how expensive our monthly health premiums are. In fact, Americans pay more for their healthcare than any other nation on earth. Per capita, we pay more than anyone else. So, what's the difference? Well, there's a bit of a time bomb that's ticking right now. And it is going to detonate at the end of 2025. And when that time bomb goes off, your health premiums, they could increase anywhere from 50 to 100 or even as high as 250 or 300%. These are massive increases, much bigger than things you've seen in the past. But why is that happening, and how can we stop it? To understand this, we have to take two quick steps back. First, to a couple of days ago. As you know, the government shut down on October 1st. And the reason it shut down is because Democrats and Republicans cannot agree on a new funding bill. There has been some comments out there that Democrats are fighting for healthcare for illegal aliens. That is actually not true. I'm going to explain in detail what it is Democrats want and why Republicans aren't agreeing to it. So to understand that, we have to take one more quick step back to 2021. That was when COVID was at its peak, inflation was really hot, and affordability was a concern, and a lot of people had lost their jobs too. So, in the Inflation Reduction Act, which was passed to give relief to American citizens, they included something called enhanced premium tax credits to lower the cost of plans purchased through Affordable Care Act marketplaces. Now, you might be thinking, oh, good, this video doesn't apply to me. I'm fine because I don't use Affordable Care Act. I don't use Obamacare. I use the Georgia state plan or the Florida plan. I got bad news for you. A lot of those state plans are actually ACA plans, just wrapped in state branding. There's a few reasons that has happened. Just know that even if you think you don't have an ACA plan, it's possible you do. So this is going to affect everyone. In fact, it'll affect directly about 24 million Americans who are enrolled in ACA marketplace plans. Of those 24 million Americans, 92% of them are actually taking advantage of the advanced premium tax credits to afford their healthcare. Without them, they may not be able to afford healthcare at all. Now, those tax credits, they had two really important consequences. First, low-income people who already qualified for subsidies, they got more tax credits to make their healthcare costs lower. Second, and this was huge, middle-class earners, typically people making about $62,600 a year is how we define that, they became eligible for tax credits they otherwise wouldn't have gotten. And that helps lower their costs too. But when these credits expire at the end of 2025, Americans, especially families and working class Americans, will pay substantially more for their health premiums. Now, to understand what kind of increases we're looking at, we actually have to understand the federal poverty level and how it is used to measure what kind of subsidies you can get. I'm showing you a chart. This is from the Department of Health and Human Services. This is how the federal government defines poverty. And you can see it changes based on how many people are in your family. For an individual, the federal poverty level is $15,650. For a family of two, it is $21,150. These numbers are important because what you earn relative to these federal poverty levels decides how much of a subsidy you get. So let's take a quick example here to see how bad this can get for people. Let's take a hypothetical couple, a 60-year-old married couple. They have a combined income of $85,000 a year. So not living the high life, but not broke either. They're making a pretty decent income. Well, $85,000 for a family of two, that is 400% of the federal poverty level. That completely eliminates your eligibility for any of these tax credits. So right now, with the tax credits, this couple could pay $7,200 a month and get their health plan. But without them, their premiums will rise $21,339 for a total of $28,564 a year, up from just over $7,000. Now, granted, this assumes an 18% increase in the underlying premium costs, but I think that's a safe assumption because premiums go up every year regardless. But the elimination of those tax credits It's massive. I don't know where this couple is going to find another $21,000. I think what'll happen here is we'll have people just opting not to have health insurance. But what about an individual? Let's take a 27-year-old making 35 grand a year. Well, 35 grand a year, that's more than double the federal poverty limit. So this person could see their rate increase by 150%. Their monthly premiums could be something like $2,615 a month. That is a mortgage. I don't know where a 27-year-old making 35 grand a year is even going to find that cash. Again, this is a person who might simply not have health care. And let's take one more example to show like how this is affecting different people. Let's take a couple, 49 years old, they've got a 19-year-old child. So that's a family of 3. They could see their prices increase by 44% for a total of $8,964 a month. That is an insane amount of money. I don't know how many people watching this video can afford $8,964 a month. Even if you're making 90 grand a year, that's your whole income. And I'm getting a little heated. Sorry, guys. I'm going to calm down. It's just, it's like the people who designed these policies have never been working class. It's like they don't understand how much money $1,000 a month really is. Currently, Republicans want these tax credits to expire, and they understand that that's going to increase people's health costs. They're okay with that because they're saying it's going to save the government around $30 billion a year. I've seen $33 billion. I've seen a little less, but I've fact-checked this, and Republicans are right. It would save about $30 billion a year. But when we compare the costs, $30 billion a year to keep these tax credits against some of the items prioritized in Trump's One Big Beautiful Bill Act, you can see what Democrats are saying. They're saying, there are other places we can find savings to fund these tax credits because they are so important. I think the Democrat position is, hey, we're the richest country of all time. Wouldn't it be nice if Americans had affordable health care? And we can't afford that. The Big Beautiful Bill, it allocates $170 billion towards immigration enforcement over the next 4 years. It allocates something like these expanded tax breaks. It's going to cost about $750 billion through 2034. So that's just 2 examples. Between those 2, I think Democrats are right to say, surely we can find savings elsewhere to fund this program. If we're really trying to have a lean, clean budget, let's trim down a little bit of the immigration enforcement. Let's maybe roll back some of the tax cuts for the rich. Again, these tax cuts, they're not for you. They're not for you. They are for the richest 1%. Surely they can deal without one tax break to help everyone have health care. But still, the other issue is, even if let's say we didn't want to do this because it was unaffordable, fine. The economic cost, not to mention the human cost of unaffordable premiums, will far outpace any short-term savings. So currently there is no deal, which is a major reason why the government shut down this week. And although the Trump administration insists this is all because of Democrats and the radical left, if you don't know what I'm talking about, just go to the Department of the Treasury and look at what the banner says right now. Now, that is a violation of the Hatch Act, by the way. That's actually illegal for these agencies to do that, but that's another video to discuss later. But I think Republicans, despite all this messaging, they don't want their constituents to get hit with these unaffordable premiums. I think Republicans are actually in a pretty desperate position where they have to stay on Trump's good side, but they also have constituents they answer to back at home. And here's a fun fact for you. Most red states have chosen not to expand Medicaid, which means that red states will be hit the hardest when this ticking time bomb goes off in 2025. Republican voters starting 2026, if this problem isn't sorted out, their healthcare costs might double or triple. And it's going to be really hard for Republicans to say it's Democrats' fault. So because of those factors, I think it's possible we'll find a deal here. But I've talked enough. You tell me what you think. Is there going to be a deal to preserve these tax credits? If so, what might that look like? How long is this shutdown going to go? Is this going to break Trump's previous record of 35 days, or can it be resolved sooner? And what are you doing during the shutdown? Please let me know. Join me in the comments. I am working really hard to get better at the long form game. I've been a short form vertical guy for a long time, but this way we can do deeper dives and really explore the legal issues in much more detail. So, hey, I'm glad you're here. Like and subscribe. I'll see you guys next time.